Some other news dropped in from Moderna, which now wants emergency use authorization for its booster shot for all adults. Pfizer, has already asked for the green light for theirs, and that could come maybe by the end of the week. Health experts are out there saying, hey, do not wait to get a booster because we may be in this winter surge already, and some of them are worried about what the flu could add to the whole situation as that season begins. Right now, you've got 83,000 COVID cases a day, up 14% from last week, and the number of people dying from COVID, more than 1,000 per day. You know which state's struggling the most right now? Check out this map. It's Michigan, with hospitals totally packed. So we're asking the country's top infectious diseases doctor and the president's chief medical advisor, Dr. Anthony Fauci, about what he's expecting. Dr. Fauci, thank you for being on launch night of the show. It's good to be with you.
Thank you. It's good to be here, and thank you for having me.
Of course. So let me start with booster shots. Big news on that. We know all week long. We know today Moderna actually asked the FDA for emergency use authorization for its booster. You've got the Pfizer EUA out there for American adults. So two questions for you on this. Do you anticipate that both Moderna and Pfizer will get the green light? And could that happen for at least one of them, Pfizer, maybe by the end of this week?
Yeah. Well, first of all, I think it's very important that we get boosters available for people in this country. And I don't want to get ahead of what the FDA is going to make a decision. That's not productive. I believe that we are going in the right direction with this, and quite soon we will have availability of boosters for everyone. One of the issues that we have that sometimes confuses the American public is if you talk about boosters for one subset of group versus another another, sometimes even those who are eligible, officially eligible to be getting boosted, hesitate because they're not really sure if they fall in that category. If you give an across-the-board approval and recommendation for people, for example, from 18 years of age or older, that adds a degree of clarity to the situation.
You've been really clear, Dr. Fauci, and you and I have talked before even about the need, in your view, for people to get the booster shot and for that to be widely available. And yet there's some reporting that's out there, the Washington Post, for example, that says that Dr. Walensky has privately cautioned against, the concerns about making those boosters too rapidly available, basically too much too quickly, and that could be problematic. Should people be concerned that our top health officials may not be on the same page on this?
No, I believe, Hallie, and I thank you for giving me the opportunity to clarify that. Sure. We are on the same page. And what Dr. Walensky has always said is that she wants to let the science drive the decisions. And she's looking at the data that will come from the FDA. The FDA authorizes and the CDC recommends in association with their advisory committee. We've always been on the same page. I think people misinterpret when she says we want to wait to see the data, that she's not in favor of something. She is. We are on the same page with her. There's really no distance between us at all on that.
Okay. When you look at where we are right now, we are just over, a week now until Thanksgiving. There's this talk about the potential for a winter surge. Should we be bracing for a surge to be happening after Thanksgiving? Is that what you anticipate given folks' holiday plans?
Well, it's going to be up to us, Hallie, about what happens to us during the holiday season. We've got to start right now getting anybody who's eligible, and I hope in the next day or two that's going to be essentially everybody that's been initially vaccinated, to get them boosted. And we've got to realize that when you're in a situation where you're having 80,000+ new cases a day, when you are in an indoor setting in which you don't know the vaccine status of the people in a congregate setting indoor, you should wear a mask.
You see the patterns of people. I think you have an understanding of the desire of people to get back to some semblance of normal life, especially over the holidays. You pair that with what we're seeing with these flu numbers. And I don't have to tell you about those right now. There are some alarm bells ringing about the possibility of this so-called twindemic, right? Being in a not great place on the COVID pandemic, being in a not great place on flu numbers.
Right.
Should we expect a twindemic this winter in your professional assessment?
If we didn't have a flu vaccine, if we didn't have a COVID-19 vaccine, I would be telling you I'm really concerned we don't have anything to stop this. But we have an influenza vaccine. Get vaccinated. It's totally available to anybody who needs it right now and wants it, and everybody should get vaccinated 6 months of age or older. Number two, we have a highly effective and a very, very safe COVID-19 vaccine that I hope very soon will be available not only to everybody in a primary, but to everybody 18 and over in a booster. So we have the tools. You're asking me to make a prediction, and I'm saying the public will make their own decision. If they don't want to see a big surge, then do the things that are being recommended to prevent that.
Dr. Anthony Fauci, message received loud and clear. Thank you so much for being on to join us tonight on Hallie Jackson Now. Really appreciate you being with us, Dr. Fauci.
Great to be with you, Hallie. Thank you for having me.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.